We're now in the laboratory area of the records room in the student surgery area. And we have a blood sample for our patient. We'd like to run a pre-anesthetic packed cell volume and total protein. So what we're going to do is we're going to transfer some of this blood to a hematocrit tube, 2 of them specifically. And we have some putty here. And so what we're going to do is take the needle off. We're going to transfer some of this blood into the hematocrit tube. And then we're going to push it in this putty. And we'll do 2 of these. We take our sealed hematocrit tubes and we put them in the centrifuge. And the end with the putty faces out. And you put the tubes on opposite ends of the wheel here. And then importantly, you need to put this cover on, and the cover screws on. If you don't put this cover on, the tubes go flying out of the centrifuge and create a mess. Close the lid and set the timer for 3 minutes. Once it's done spinning, open the lid. Unscrew the top and take your tubes out. Now to read the hematocrit, what you want to do is line up the putty red blood cell interface at 0, and you want to slide this along so that the top 100% lines up with the serum. So I'm sliding this along. The putty red blood cell interface is right at the 0. And the serum, which is hard to see, the serum meniscus is up here, which is clear, is right at 100%. And then I look to see where that serum red blood cell interface is. And in this case, it's at about 12 to 13%. 13%. So this blood has a packed cell volume of 13%. Now that actually wasn't the true packed cell volume of our patient. This blood was some leftover blood that we used just for demonstration purposes. Now to read a total protein, we're taking our refractometer, we're opening the lid, and now we're going to break this hematocrit tube right about in the location of that serum red blood cell interface, but a little bit more in the serum. And then what we're going to do is we're just going to drop some of that fluid onto this glass surface of the refractometer. And if you're patient, it'll just fall on there. Use a little bit of surface tension to get it going. You don't need to tap it on there. Basically, try to coat sort of this surface down at the bottom. Once you've done that, you can flip this down and then read it by aiming it towards the light and pressing down on the refractometer sort of door here. If it's not immediately clear, you may not have enough serum on the surface of the window. And so what we'll do is we'll add a little bit more. We'll close the window and re-look. And there are 3 scales. One is grams per deciliter, and one of the other ones is specific gravity. We want the grams per deciliter. So in this case, this has a grams per deciliter of 3.4. When you're done using the refractometer, wipe it with one of the Kim wipes and rinse it with a little bit of distilled water. And record your results. Now, for most patients, a packed cell volume and total protein is adequate pre-anesthetic blood work. If your patient has a condition or situation that you feel might warrant additional blood work, discuss that with Dr. Anderson or one of the anesthesia staff.